The VRC07 antibody has been tested for safety in animals and no safety problems were seen. In these studies with animals, VRC07 was given in doses 20 times higher than those used in this study. There are several active clinical trials looking at VRC07 or similar antibodies. As of August 2017, it has been given by injection or IV to 38 people in an ongoing clinical trial at the NIH Clinical Center. So far, the study antibody has not made people too uncomfortable or caused serious health problems. As of July 2017, similar antibodies called VRC01 and VRC01LS have been given to people in 14 clinical studies in the U.S., Peru, Brazil, Switzerland, and in sub-Saharan Africa. More than 2,400 adults and 33 infants have gotten these study products. These studies are still going on. Participants in both of these studies are receiving either the study product or antibody or a placebo, so that's basically a liquid with no antibody in it. Many participants said they had mild pain, itching, or redness where they received the antibody or placebo. Some said they felt they had the flu after getting the antibody, but the feeling lasted a few hours at most. In a previous study, one person who got a study antibody by injection had a rash. One person had a brief fainting spell several hours after getting a study antibody by IV infusion. To be safe, no more injections or infusions were given to these people. Some participants had mild body discomfort, muscle pain, or joint pain after getting the study antibody. There were 2 reported incidents of participants developing infusion reactions shortly after VRC01 administration by IV. Their symptoms were typical for infusion reactions observed with other monoclonal antibodies. Other antibodies have been given to people for other illnesses. In these situations, most side effects occurred within the first 24 hours. The side effects most commonly seen included fever, chills, shaking, trouble breathing, low blood pressure, itchiness, hives, rapid heart rate, chest pain, dizziness, headaches, nausea, vomiting, high blood pressure, rash, lips or face swelling, and diarrhea. In rare instances, some antibodies cause serious reactions that could be considered life-threatening. One was anaphylaxis, which is a physical reaction that occurs soon after the antibody is initiated or started and includes the following symptoms: difficulty breathing, hives, low blood oxygen level, low blood pressure, rash, and swelling in the mouth and face. They also experience serum sickness, which is a physical reaction that can occur several days to 3 weeks after getting an antibody and includes the following symptoms: fever, hives, rash, chest discomfort, enlarged lymph nodes, muscle pains, joint pains, shortness of breath. Lastly, they had cytokine release syndrome. These symptoms occur most often in the first few hours after the first infusion of the antibody. The symptoms associated with cytokine release are fever, hives, itchy skin, shortness of breath, difficulty breathing, physical weakness, chills, rapid heart rate, tightness of chest, lack of energy, stuffy nose, runny nose and or sneezing, headaches, nausea, vomiting, flushing, fatigue, low blood pressure, sensation of the tongue or throat swelling, wheezing, and excessive coughing or cough. We don't want you to experience any side effects. Therefore, we need you to tell us if you have ever experienced reactions similar to the ones we listed above and the cause of the reactions if you can remember. There are a few other rare side effects that have been linked to antibodies licensed for treatment of other diseases, such as a blood disorder that interferes with blood clotting, cancer, damage to the heart muscle, and the body's immune system attacking healthy cells. These side effects and reactions have not been seen in other studies with VRC01, VRC07, or similar experimental antibodies.